American Academy of Pediatrics is now reporting nearly 204,000 new COVID cases in children in the last week. Kids under 12 are still not eligible to get vaccinated. Now, as more students head back to school, the debate over mask mandates is intensifying. ABC's senior national correspondent Steve Osunsami is outside the CDC with more.
This week, it is back to school in Chicago after nearly 18 months away from the classroom. And as more children across the country head back to schoolrooms, the fight over face coverings in the classroom is getting more intense. On Monday, the Department of Education took it to a new level, launching a civil rights investigation into 5 states where Republican governors have made it against the law for school districts to require their students to wear masks. The government is accusing Iowa, Oklahoma, South Carolina, Tennessee, and Utah of discriminating against students with compromised immune systems and other issues that make those students more vulnerable to catching the coronavirus. For now, the feds say that they're ignoring states like Florida, Texas, Arkansas, and Arizona, where they have similar laws, but they're tied up in court.
We know the spread of COVID happens when masks are not being used. We need to get those students back in because many times those are the students that really require the most support.
Last week, there were nearly 204,000 new cases reported of sick children, the second highest week on record.
What we know is that the risk of COVID is far greater than any concerns that parents should have about masking. Masking is a simple weapon that we have to making sure that we have a school year that is successful for all our kids.
That simple weapon is dividing school systems and their parents, who are screaming and yelling at school board meetings across the country and staging protests outside school offices.
Unmask our kids!
At this school board meeting in Florida, where they just recently required students to wear masks, it got physical.
All of this on live television.
There's a post from the former Secretary of Education that's getting a good deal of both praise and criticism this morning. Arne Duncan worked under President Obama and compared people fighting face coverings to suicide bombers at the airport in Afghanistan, saying that they both blow themselves up, inflict harm on those around them, and are convinced they are fighting for freedom. One thing that, of course, could help ease concerns is making young children eligible to get the vaccine. And there are some who hope that the government can get to that point by this winter. Diane.
All right, Steve Osunsami. Steve, thank you. And let's bring in ABC News medical contributor Dr. John Brownstein of Boston Children's Hospital for more on this. Dr. Brownstein, as always, thanks so much for being here. We heard there in Steve's piece, the Department of Education is launching a civil rights investigation into 5 states where governors have banned schools from requiring masks. What do you make of that?
Yeah, this is really concerning. You know, it's so important to get our kids back in classrooms. I think we all agree. And that masking is just a simple tool to get kids in class safely. And CDC recommends it for everyone in schools. But what's happening here is the Department of Education is saying the banning of indoor mask mandates particularly discriminates against students with disabilities. You know, we're particularly concerned about kids with immunocompromised conditions or medically vulnerable, and they're the ones who would be unfairly targeted by increased risk of COVID in classrooms. And unfortunately, those kids would have to stay home. So we're concerned about all these children, about rapid increase in cases among our classrooms, and this is why masking is just that simple tool to get our kids in classroom. I think we all agree with that, and it's because majority of our kids are unvaccinated, and they will be the main host for spread. And so again, we know masking in classrooms limits transmission, and if the aim is to get kids in classrooms, that's what we have to do.
Last week, there were nearly 204,000 new cases in kids. There's been a 427% increase in pediatric cases over the last month. So are you seeing an impact at Boston Children's Hospital, and how concerned should parents be right now?
Well, I'm overall definitely very concerned about the rapid increase in kids. It's the most significant we've seen since the beginning of the pandemic. And this is just as kids head back in the classroom. At Boston Children's, we're not really seeing that increase yet because we haven't seen that overall surge in the Northeast. But overall, we have a concern across the country. Of course, the concern is that, kids, will get infected, not necessarily as severely ill as adults, but overall, with more transmission, more Delta variant spreading, we will see that. And so what we think right now is that we have the tools to keep our kids safe. I mentioned masking, but it's also social distancing, ventilation, testing, we can implement that in the classrooms, and of course, getting those that are eligible for the vaccine vaccinated. This is what we have to do coming into this year if we're going to keep our kids safe.
Now, we're also hearing the CDC is now saying that they're seeing a slight drop in the vaccine's efficacy at preventing hospitalizations, particularly among older people. So how concerned should we be about that? Should we be looking to get boosters, for example, sooner than 8 months after the second Pfizer or Moderna shot?
Yeah, so we have to remember this is data from Pfizer. It's not peer reviewed. It did show that the vaccines were declining in efficacy for severe illness to about 84%. They had max efficacy about 1 week to 2 months after receiving the second dose. We are seeing that waning of immunity. This is something we expect with all vaccines. It's not super surprising. We also saw data from Israel. But even at 84%, these are amazing vaccines. And yes, we have to be considering boosters potentially because that efficacy is dwindling, because we want to restore efficacy against Delta, and we want to just reduce transmission and less long COVID. But we have to remember, it's not a cliff. It's not 6 months or 8 months. We recognize the fact that immunity wanes gradually over time, and 8 months actually may be a more effective timing. We just don't know, and we need that data. The FDA has yet to approve boosters for the general population. We're waiting for that. But in the meantime, we have to keep messaging these vaccines work, and it's those that are unvaccinated that really need to get that shot right now.
And then, of course, we're slowly approaching cold and flu season now. So when should Americans get their flu shots? Does the timing of when you got your COVID-19 vaccine impact that at all?
Yeah, I'm very concerned about a flu season. We've not had a bad flu season in a couple of years, and now we have reduced immunity. We have a flu season coinciding potentially with a surge in COVID. Getting your flu shots around September, October, get it as soon as it's available to you. That may be around the same time as boosters. What CDC is saying is that you can get them at the same time. If you can space it, that's great, because then if you have any adverse event, we'll know which vaccine was at play. But the real important part here is to get both of those vaccines. We don't want to have what we call a twindemic, surges in flu, surges in COVID. Our hospital systems can't cope with that. So we all have to do our part to reduce transmission in the community this fall.
All right, Dr. John Brownstein, always great to have you. Thank you.
Thanks so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.